welcome to Cinder of the Universe. I'm Cinder. This is my universe. Wanted to give an update on my discoveries because I haven't really updated the channel or my social medias. Anyway, so diagnosed with Ehlers-Danlos connective tissue disorder by 3 medical professionals. Every one of them needed to re-diagnose me. And it has been confirmed, and they're like, oh, gee, yeah, you got this. I'm not positive why they think I have Ehlers-Danlos over having hypermobility syndrome, but according to the diagnostic criteria that is as of then and now, I have Ehlers-Danlos. I do not have the very worrisome versions of Ehlers-Danlos that, can make you die at any moment because you're going to have an aneurysm or your heart's going to blow out. Okay, my heart's fine. In fact, the cardiologist at the time that I got tested said that my heart was, it looks like a free pile. My heart was the healthiest they've seen, but I also know that that's a tactic that the medical professionals like to say so that you feel better about things. I wish they would just give me the data. But in any case, I didn't know as much as I know now then. However, I don't have the bad heart worrisome things, so that is good. I've been diagnosed twice, one by a neurologist, one by a naturopath doctor that handles lots of mast cell activation disorder, and 3 times because an allergist that specializes in mast cell activation disorder also confirmed the mast cell. So 3 medical professionals have confirmed that I have mast cell activation disorder. It's been the criteria for clinical criteria, as well as I have lab data that meets the criteria as well. So it wasn't just like, oh yeah, you look like you're lots of problems, so I'm gonna just say you got this. No, I actually have some labs, which is what I want. I want data. Like, I don't want a doctor to just tell me, hey, you have this thing. I'm sorry, I don't trust you guys anymore. Sorry, not sorry. Actually, it's just a fact of life, and you don't want me to put blind faith in you anyway, because as a medical professional, there's only so much you can do, and only so much you can know, and only so much you can hold in your head at the same time. So in the society that I'm in the world that I'm in, with the doctors that I visit, it's more of a partnership, and that helps me feel better about it, not so frustrated and angry about things, which I have every right to be for all of the reasons. However, it's not a great place to just stay emotionally. So, and then I am, get this, diagnosed with Dysautonomia. Yeah, one of those, we're gonna diagnose you with a clinical picture. That's not a proper diagnosis, by the way. It's not, that doesn't work that way. So I was like, why, what, how, when, who, what? And finally got scheduled for a tilt table test so I could find out if I have the criteria for POTS. Postural Orthostatic Tachycardic syndrome. And was inconclusive. I didn't quite make the criteria. Like, there was stuff going on and it wasn't great, and I just didn't make the numbers for the POTS. Yay, diagnosis criteria. So then I was diagnosed with dysautonomia, because we don't know what's going on. Orthostatic intolerance, which is just more clinical picture, not why. I don't know if I have hypopots. I don't know if I have hypo. I don't know if I have an adrenal issue. I don't know why I have the dysautonomia problems, but a lot of the medical professionals just like to shove it under mast cell activation disorder and Ehlers-Danlos and be like, shit sucks, sorry. Here's salt, wear compression stockings, drink lots of water, And here's some emergency fluorocortisone in case you really got some problems. And contact me if you're fainting a lot, because that's dangerous. Yeah. So still have things to discover there. Hopefully I'll get that figured out. I have got it figured out just a little bit, because there's a reason it's not quite POTS, why it's not quite this, why it's not quite that. Because this year, 2025, and I've been on this journey since 2010, when I seriously started looking for professional medical assistance. So that's 15 years. Wow. This year, I was officially diagnosed with cervical cranial instability. So yeah, my head wants to fall off, basically. That's putting it lightly, in a humorous sense. The tendons in my neck. And I'm not quite sure to what extent this instability is. I'm not sure if it's a coaxial, I'm not saying that right, sorry, instability, if it's, if there's a particular ligament, but let's see. My left side of my head, when I turn it this way, slides that much, about an inch or just under an inch, slides more than it should. And this one slides more than it should, but less. And that's only with the x-ray. Like, I had one up, then I had an x-ray here, then I had an x-ray here. I didn't have the motion. My motion x-ray is scheduled in the next couple of weeks. And that'll be a motion, digital motion x-ray. Which I need to figure out how to pay for, because insurance doesn't cover that. Lovely, huh? But that will determine what amount and what a little bit more of what's sliding around in my head, and I'm or in my neck head area, but it's a significant amount that can explain a lot of the dysautonomia symptoms that I have. And there was lots of symptoms that pointed to it, and after copious amounts of research, copious amounts of looking through support groups, just tons of me looking, reviewing, watching videos over and over, just writing lists, finding diagnostic criteria, finding lists, finding symptom lists, tying it all together. I was like, okay, I think this is what it is. And I was like, I think this is what it is. Went to my doctor, said, oh, that very well could be. Well, the first thing we have to do is send you to physical therapy. And I'm like, oh, interesting, because everywhere I'm looking and reading says that if you go do physical therapy without figuring out exactly what's wrong with your cervical cranial instability area, neck, whatever, then there's a high chance you could cause more damage and, could actually ruin things and maybe lose the use of your limbs. But, insurance rules the world in the medical profession. And so I don't get x-rays or MRIs or anything unless I have copious amounts of money to spend, or decide to just go do physical therapy for however many months the insurance decides is enough, and then goes, oh, well, I guess that's not working. Maybe we should see what's going on. Very frustrating. Lucky for me, I haven't got worse with physical therapy. There was moments where I got worse, and I just kept up the communication and was like, okay, we can't do that yet. And so, okay, we're going to back it off. We'll work these muscles. So I did find a physical therapist office that had a couple physical therapists that have dealt with Ehlers-Danlos and connective tissue disorders and cranial instability as well. Lucky for me, the chiropractor that I've been going to for the past, over almost 13, 14 years now, has also progressed. Like, I was one of their first Ehlers-Danlos patients, and then they progressed. There was others with me as well, and then it progressed to cervical cranial instability patients, so they're adverse in handling that. And I was able to, get back in the office, get back on the schedule, and between the physical therapy and the chiropractor, I'm actually seeing improvement. And my symptoms are reducing, so that's very good. To what extent, we don't know yet. So I'm still got to wait for the x-ray, and I have an order in for the MRI, but I haven't received a call back in the last week and a half, so I'm pretty sure that it's been denied, most likely. So unless I want to go spend a few $100s on an MRI cash, I'm kind of SOL, and I don't have that money. I am like a very broke single mom with no child support whatsoever, and going to school for a degree for hopefully I can do the things. So I'm working at it. I'm not what am I trying to say? It's like, oh, I'm actively seeking employment, okay? But it's also like I have a full school load. Like, I'm a full-time student in cybersecurity. Like, that's a lot. It's a lot, okay? And then dealing with the health stuff and not having all your mental and cognitive facilities working when you need them, and it's kind of sporadic. That's really difficult. It's really difficult. So I've got a big load, and I am lucky to have support structure. So I'm surviving, and I'm also living off of a lot of support. So I'm grateful for that, but I do like supporting myself, and I don't like being on financial aid and state aid when I don't have to. Like, I want to leave that available for people who super duper need it, and apparently I am one of the people that super duper need it right now. So, I mean, it makes sense. My head wants to fall off. But, so I have to figure that out. How am I going to discover? Because I need the MRI to see what the tissue is doing. How many nerves are getting pinched, what blood vessels are getting pinched. You can kind of get an idea from an x-ray. You're like, your stuff's supposed to be in this area, but every person is different. Your veins aren't all located in the same exact spot, but like perfectly. And when you're working on just a slide here and there and a slide back and forth or whatever the slide is, like, I could be pinching vagus nerves. Like, there's times when my lower half of my legs go numb and I feel like I'm gonna collapse and I can't move forward. It's concerning. I wake up in the middle of the night and my arms and legs are numb, and I'm like, I was just laying on my back, supported perfectly. What happened? I don't know. I was asleep, right? So, gotta discover that. But that could be causing a lot of my dysautonomia type issues. And that's where I'm at. That is where I'm at. Oh, and then of course all the things that come along with that, like I've discovered that I'm now insulin resistant, even though I am not your typical American eating diet, and I don't eat tons and tons of sugar, though I do have a sweet tooth, and it is annoying as hell. And now it's like, I wasn't a crazy donut eater, sugar muncher, and then all of a sudden I need to be in absolutely none of it, no fruit, no carbs, no nothing, in order to kick into gear. So now I'm working towards a mostly carnivorous diet. I like saying carnivorous. It makes me feel like a carnivorous plant, and I dream of being photosynthetic. That would be amazing, and in a way I kind of am a little bit, but as a human, we are a little bit, I don't know, it's pushing it, but not quite to the same extent as plants. And I would like to get a lot of my nutrients by just osmosis in the air and from the sun, and not have to worry about eating it all. That would be great, because all the gut issues that come along with mast cell and Ehlers-Danlos and connective tissue disorders and dysautonomia, and messing with the vagus nerve and messing with the autonomic nervous system affects the digestion, affects the stomach, affects the gallbladder, affects everything in your body. So, like, food is a pain in the butt, sometimes literally. Yeah. So insulin, gut issues, and a crazy set of headaches and migraines of all kinds of different degrees. And if I get too heavy, which heavy for me, most people are like, I wish I could be that weight, but heavy for me is anywhere from over 100 and 135 pounds to so on and so forth, but like from 135 to 160, I've been back and forth in that area, and that area, it gives me lots of headaches. And the more weight I get on from 135, the more inflammation I get, usually because I'm gaining weight because of inflammation, and that seriously affects my headaches, seriously affects my migraines, and then I start getting pressure headaches that are very similar to someone who has Chiari malformation, which there's different levels of Chiari, and it's not always a malformation, but basically if there's too much inflammation in the brain and the area in the neck, then it's gonna sink those brain tonsils down into the spinal cord cavity in the neck, and it basically blocks the cerebral fluid in the head from moving in and out like it should up and down the spine, and then it builds up pressure in the head, and that is extremely dangerous, and it's very frustrating when medical professionals are like, oh, that's okay. And, I talked to the neurologist. I said, I think I'm having brain inflammation. He says, oh, no, you can't have brain inflammation. You would be in the hospital. I said, well, obviously I'm not in the hospital, but I'd like to be. It's very frustrating because in my situation, if I go into the ER, that's like sending me almost into a death trap. It's not a good idea. They don't know how to handle me. They don't know my situation. It's very rare that there's going to be the person on staff that's going to know how to handle to this level of what I've got going on. And it's a huge clinical picture. It's a huge mess. And frankly, they're more set up to, like, if you're losing a limb, then you go in. If you're bleeding out, you go in. If you need to get into surgery right away, you need to see what's happening so that you can sew it back together, you go in. But like, I went in for headaches and stuff, and they gave me all kinds of different things, and it didn't do a single thing, because the problem was the pressure. The problem was the inflammation. The problem was the brain swelling. In any case, it's pointless for me to go to the ER unless absolutely necessary. If I'm not dying, then I need to just suffer where I can suffer, and then see the medical professionals that actually have been working with me and know what's going on. Yeah. And I'm lucky to have a pretty darn fantastic doctor that when I go into the office in these areas within this network that I'm finally found, like, practitioners in this health area that I'm in, uniqueness, and I mentioned my doctor, and they're like, oh, okay, you're one of their patients. Okay, all of a sudden it's like, now it's okay to take me seriously, which is really annoying, but I'm also really grateful because it's been a long ride. So having that doctor behind me, and then also I have to be on a plan. They don't just see patients haphazardly. Like, it is a concierge clinic. I have to pay a monthly fee, and that does mean that I get contact with my doctor at almost any hour. Like, I can message them and get a response that day. And they say 24 hours, but honestly, they get back to me within 2. It's like whenever their break is, they get a little notice that they got a message and they get back to me. And there's been a couple of times where I've had that headache, migraine, for over a week and a half, 2 weeks. I think actually it was like 2 weeks. And that gets to the point where your brain starts to realize that you're just going to have a headache forever, whether you need it or not, whether it is or isn't, you're just going to have a headache. And so I was able to get into clinic and get one of those migraine shots and get it taken down really quick. And then I was on it. And like, before I had this doctor, I was chasing things for like 6 months at a time and suffering the whole entire time, trying to get into the clinic, trying to get in as a new patient. And during some of my massive problematic moments, happened in the big C moments. And so very difficult. In fact, I literally lost my doctor at one point because they got sick, and this was a different doctor. They got sick, and just like dropped their patients, and I was just left, just left, and no contact, no nothing. I had to find another doctor, and that's when I ended up finding the one that I have now. So every month I pay a freaking fee, and you know what? In the end, it's also not covered by insurance. I also don't get to use that, which is very frustrating. If I had nice insurance, it would be covered, but I have complimentary state insurance, which I'm very grateful for. Don't get me wrong. It's just there's a lot of medical professionals that just will not take it. They just won't. And then the ones that do take it, they have a list of how many people, and if you're not in their quota, you're not in your quota. And then they also will fire you if they don't want to deal with you, and they'll take on other patients, because then they can tell the state that they are taking the insurance, they are taking patients, but they have a number that they have to stick to. And it's unfortunate. However, if they don't do that and they're overrun with state insurance patients and they don't make their money, like, practices have gone under. Yay. Okay. Anyway, long rant there, and I could probably make a bazillion videos on all the stuff that I've gone through and been through, but that is where I am in my health search. So right now, I need to find funding for an MRI. I need to find funding for doctor's visits, because I'm completely like tapped out at this point, and then I need to find funding for that x-ray. And then depending on what I see from the MRI, depending on what I see from the x-ray, that means whether or not I can continue moving forward with physical therapy and just trying to be healthier and stronger and manage the thing and hopefully heal from it. But that is very small chance. The procedure that I'm in trajectory for is PRP. Yeah. Plasma rich something. Plasma rich something. Basically, they take your blood, like a lot of your blood, and they inject it into different areas along for your tendons, and basically aggravate them and cause minor inflammation in order to get it to start healing and tightening up the ligaments. So my ligaments in my neck and around my cervical head and up into my head here and into my jaw in these areas are going to harden up and actually support my head and neck. So that's where I am. Okay, thanks, bye.